So I'm happy to introduce our next speaker, who comes from the United Kingdom. Her name is Liz, and I'm sure she'll tell all about herself and her startup. I don't know if you can call it. It's just a startup. It's the organization for the review and care and health applications. Review of care and health applications. So it's supposed to make it easier for, I guess, people to choose from which app to use, and also hospitals probably, and everyone who uses these apps. So seems very interesting. I'm giving the floor to you now. You can ask her questions, the same system as before, and go ahead.
Okay, thank you, and thank you for having me here today. So as was said, my name's Liz Ashall Payne, and I'm the Chief Exec and founder of Orca. Just to put this in context, I didn't start out my life with the ambition of working in digital health or mHealth. I started out my career as a speech and language therapist, working in complex paediatric care. And very early on in my career, I got really interested in wanting to do more for more patients, because as a clinician, I could only support the one person sat in front of me. And I knew full well that there was a caseload that also could need my support, and a population out there that also could do with some care. So that took me on a journey of getting interested in change, and that brought me an interest into innovation. And eventually, when we all started to buy smartphones, I saw that as an opportunity to support innovation and change. So today I'm here to talk to you about Orca and the work that we've been doing predominantly across the UK with the NHS. And because I'm here to talk to you about health apps, I'm just going to ask you a couple of questions, and I want you to think about what you think the answers might be. So the first question I want to ask you is, how many health apps do you think there currently is on the marketplace? I don't need to shout out, just have a think in your mind about how many you think there might be. The second question I want to ask you is, how many downloads do you think our populations do every day? This is a global figure. I want you to think globally. The third question is, what percentage of healthcare professionals think apps could help their patients? And the final question I want to ask you is, and this is for the parents amongst us, how many out of every 10 children aged between 11 and 16 own a smartphone? Okay, so I'm going to give you the answers. Let's see whether you were near or right. Okay, so there's currently over 326,000 healthcare apps available to us today. What we see is 5 million downloads every day. And I don't know if you can see this one. 93% of healthcare professionals think apps could help their patients. And then when we look at our children, 9.4, so we're getting close to 10 out of 10 children aged between 11 and 16 now own a smartphone. And so what this tells us is that as a landscape, we've got a great opportunity, because we've got lots and lots of health apps, which our patients and populations are downloading. Some of you might use a health app yourself. Our professionals think this could be a good idea. And our children and our populations have bought the infrastructure, they've bought the smartphones, and they're ready to use these products. If we drill down a little bit more into this landscape, what we can see is that in 2015, 73% of all health apps focused on wellness, so helping people to stay well. And as a percentage, that's reduced in the last 2 years. And what we've seen is an increase in health condition apps, so apps to help people manage and monitor health conditions that they have, and that's increased from 27% to 40%. Now, if we drill down a little bit more into those health condition apps, what we see is that 28% of all those health condition apps focus on mental health. 16% diabetes, 11% heart and circulatory systems, and so on. And to put this in context, that 28% of mental health apps accounts for around about 17,000 apps. So this is the size of the opportunity that we have. And if I'm honest, this was the opportunity, the landscape, which massively frustrated me. Because if we've got this opportunity, why are we not taking this up within our health and care economies? And that took me on a journey of really wanting to understand the problem. And there are three main problems. The first is awareness. So many of you today may not have necessarily been aware of that size of the opportunity. And for our populations, people out there in communities, again, are not aware that this is an opportunity that they can use or their families can use. Now, once we've raised awareness, the second problem is access. And you might think, well, we'll just go to the App Store or Google Play. Well, unfortunately, if you search for apps on those app stores, you won't necessarily get a long list, and you certainly won't get a list of good apps. So if you type in dementia into Apple App Store, you're very likely only going to get 1 or 2 products back, when in fact there are 3,000. Now, if you've been aware of these opportunities, you've accessed a health app, the ultimate challenge is trust. And this trust is not just from a clinical perspective, but it's also from a data perspective. And we're all quite concerned about what apps are doing with our data. Now, we've seen the recent news. In fact, just today, there's been some more news from Facebook about associated apps and what they're doing with data. We're all much more aware of that problem. And so we're a little bit less trusting of these products. And so I founded Orca because I wanted to challenge and break down those 3 barriers. And Orca is all about activating and enabling and empowering people, patients, and professionals to search for and find the best health app available to them. And what I want to do is just talk to you about the review process that we go through to enable trust. So we review apps because trust is the biggest barrier in this sector. So when we started this around about 3 years ago, the first question is, if you've got 326,000 apps, where do you start? And the only sensible answer, if we're realistic, is at 326,000. So what we did was we built an algorithm which pulls in the data from both the Apple App Store and from Google Play on a global level. And it first of all draws that data into a filter. And the filter initially gets rid of any apps that are redundant. Apps that are redundant are apps that remain on the app stores, but nobody's looking after them, and nobody's updated those apps within the last 18 months. Now, if an app's not been updated in the last 18 months, it's going to have data glitches, and therefore data security will be compromised. But it's also a proxy to say if it's not been updated technically, it's highly likely that it's not been updated clinically. And so we get rid of those apps. Now, what we see is over 2/3 of all health apps are redundant. They are on the marketplaces. Our patients and populations and you can go and download them, but they are not updated and looked after products. Now, with the remaining 110,000 apps, what we do is we then curate the apps into 400 categories using thousands of mesh terms. And we put the apps in rank order from the highest downloaded app backwards. And for anybody that's interested, do get in touch because we're really keen to share this data. So we've been doing this data scrape for around about 2 years. And so we're not only able to see what's happening today, but what the trends have been over time. And so what that gives us is a helicopter view of what apps are in what categories and which apps are being most downloaded by our populations. What we then do is we pick the next app in the next category to put through a manual review process. Now, if any app developers want to come through this process, you can get in touch with us and we can process the app. For any clinical environments that we're working with, any clinicians or healthcare professionals that are using apps, they can also tell us about those apps and we'll put them through the process. Now, the first thing to say about apps, and if you're going to evaluate whether it's safe, is not all apps are the same. So if you take another sector like transport and you think about a push bike versus a car versus a rocket, you wouldn't assess the safety of those items in the same way. And it's the same with apps. Some apps are push bikes, some apps are rockets. And so what we've done is we've created a classification system with NHS Digital and with NICE. And this is looking at the complexity. You can see in this triangle here the complexity of the app. So is it a simple well-being app? Does it play you whale song to help you go to sleep? Is it a digital recipe book, something very simple but potentially effective in keeping somebody well? Or at the opposite end of the scale, is it a medical device which is highly regulated and may share data across clinical data sets? What we then do is work out, well, what does the app do? What functions and features does the app have? And this includes things like gamification, links to social networking, the ability to inform and educate somebody, etc. And a combination of these two things creates a bespoke review process that we then put the app through. And there are around about 2,500 standards, regulations and best practice from a global perspective, a European perspective, and obviously at local jurisdiction level. And the relevant standards are then applied to a product around data safety and security, clinical safety, and user design and feedback. Now, in the past, when people have looked at evaluating apps, what's happened is people have looked at one of those areas. For example, they might have looked at the clinical efficacy and safety of a product, and that's absolutely critical. But if you've got a clinically safe app which shares your data in an unsafe, unsecure way, then there's a risk. And so we want to make sure that we've assessed and evaluated the app across all those different domains. Now, when we've reviewed an app, what we don't do is just say pass or fail. What we say is this app receives a score out of 100. And one of our mantras is there is no perfect product anywhere, and there never will be. And what's great about health apps is they're continuously learning from use to improve their product. So what we do is we state what's great about the app and what the side effects are, in the same way that we know in a drug environment. So a side effect may be it doesn't work for people with a visual impairment. If you don't have a visual impairment, then that's fine. If you do, you might want to find a different product. What we do at this point is we contact the developer and we share with them how they can improve their app, because we want to support a higher level of quality. I mean, we've just heard from an innovator who's really put a lot of thought into the quality of their product, but that isn't the case in all situations. In fact, only 10 to 15% of all health apps that aren't redundant meet the quality threshold that we'd want to use. And so we want to support developers by making sure that they are as good as they can be. Once they've received that report, they can obviously improve and put it back through the process. We then put the app on the app library, which is orca.co.uk. But what I can absolutely tell you is having a library of apps won't really make a big difference. And as I said at the beginning, my interest in this is about change and embedding change to benefit patients and people. And so what we do and what we have been doing over the last few years is working in England with the NHS to create local, targeted, locally branded app libraries, which are targeted to specific populations. And I'm just going to share with you a couple of examples. So this first one is an app library that we created for South West Yorkshire for children and adolescents with mental health conditions. And this app library has been promoted to children and young people in schools so that they can now go to a local app library and find apps to prevent mental health. We've also been working with clinicians along those pathways and embedding good health apps into the process which a patient goes through. So, for example, at point of referral into a service, the child will receive an app to monitor their mood so that when they come for an assessment, they can share the data from their phone with the clinician and have a better empowered conversation. Patients are also given other apps depending on their personal needs. And at point of discharge, the child is given a product to sustain and maintain. And what we've seen here is a reduction on the revolving door. So when children leave the service, quite often in the past, after 6 months, they get re-referred because they've started to see the original symptoms again. And what we've seen by using health apps, they're able to sustain and maintain their momentum. The second example is one which is deployed across Lancashire and South Cumbria, and this is around about 2.2 million people, so it's a big area. And Lancashire wanted to promote a health app library to their population to stay healthy and well, and this was targeting adults with the hope that this would prevent long-term conditions. So this has been advertised in shopping malls, in bingo halls, in pubs, etc. And what we've seen is people coming to this site to find them apps to stay healthy and well. We've supported GPs and primary care with the ability to prescribe apps to their patient when they come for consultation. And again, what we've seen is the person not needing to keep returning to the GP because they now have a product which is informing, educating and enabling them to stay well. The final example is one which we created for secondary schools. And this programme is about keeping children physically and mentally well. This app library is deployed to schools and teachers are given lesson plans to teach children about health, mental health, and an app library so that they can now search and find good products. Now, what's really interesting is just what people are searching for on these libraries. For this app library, the highest search term that we see is staying alive, which is really sad. It's targeting children who might have mental health conditions, but what we can also see is that they move through the process and download a good app. The trust issue that I talked about earlier on is not one that isn't unfounded. There are some dangerous apps out there on the marketplace. For example, there's a suicide prevention app that recommends suicide. And unfortunately, if people go to the App Store, they might download that app and have missed the opportunity to have found a good product. On the children's school programme that we run, the highest search term is bullying and anxiety, particularly around stressful times and exam periods. So what we're able to see is that different populations are interested in different products. The Lancashire one, because it's targeting wellness, we see a lot of searches for fitness, exercise, diabetes and smoking. Now, one of the key things that we've been doing across all of these health app libraries, we've got about 74 currently in England, and that's growing quite quickly, is the ability to bring the professional and the healthcare clinician along this journey. And bringing the healthcare clinician is absolutely critical, because at the moment, patients are turning up to clinics with their phone saying, look, I've been using this app. And I know as a clinician that's quite scary, because I haven't been trained in health apps. So what we want to do is train clinicians and healthcare professionals to feel empowered to use these new technologies and to have a conversation. So we provide training and education for the professionals, and we also provide them with the ability to prescribe or recommend an app through the system. The art of recommending an app is really important, because for everybody that receives a recommendation, which is a text message to the patient's phone, we see 61% of all patients download that health app. So if you think about prescription of drugs, that's about 74% conversion. So given that this is really innovative, that's great. So one of the key points that I just wanted to make, and I think I might be running out of time, is one app doesn't match everybody. So one of the questions that I get asked quite a lot is, Liz, what's the best health app? And my response is, well, it's a bit like asking me, what's the best drug or what's the best hotel in the world? It depends. And there are 4 key areas that you need to think about before you recommend an app. So the first is obviously the condition or health issue that the person's presenting with. So do they want to stop smoking? Have they got anxiety? Have they got diabetes? The second is their personal characteristics. So age has a role here. If you're a child with diabetes and you've got an adult with diabetes, they want different functions and features from the app. Obviously, any impairments that the person might have need to be taken into account. So I talked earlier about visual impairments, hearing impairments, cognitive impairments. The functions and features you need. So if you've just been newly diagnosed, you want to be educated and informed. Later on in your pathway, you might want a different product. And finally, more importantly, every day, is the technical preferences. So some of you today might have an Android phone, some of you might have an Apple phone, some of you might be wearing a Fitbit, a Garmin, you might have an Alexa at home, and making sure that the product fits the technical preferences of the end user means that people are more likely to maintain and sustain with a product. So we have created a health app library for Estonia, and you can find it at www.orca.ee. So we're currently working with about 20% of the UK population, covering between 15 and 20 million people, with thousands of professionals using our system. But what we really want to do is scale this. We've not built this just for the UK. This is a global challenge. I have in former roles worked across Europe and in other jurisdictions, and the problems that I mentioned are there in every single country. And we've been really fortunate. We've managed to get some support through some European funding to get support in Estonia to help us work out, is this something that people, patients and professionals in Estonia would be interested in? So we're really keen to get your feedback. You can go to that website today and search and find apps, and more importantly filter, so there's a filter system according to those different areas. And please contact me with any feedback. This site's only in beta, but if you've got any feedback, good or bad, and ideally we want the negative, the constructive criticism to feedback to us. So thank you so much for your time, and I'm open for questions.
Thank you. I think actually one of the questions that's upvoted here you already answered. It was about if it's possible to get some Estonian apps tested through your system, and yeah, the question if whether there currently aren't any. Are there any Estonian apps you are testing?
So we've reviewed just under 4,000 health apps, and I have to say I don't know all of them. We have quite a big team now, so I'd have to check. But We are really keen to get more Estonian apps, obviously, on the Estonian app library. The point of this system and the local app libraries is that we don't want to just support health outcomes, we want to support wealth outcomes. And for any local innovators, we want to get their apps on your local app library so people can find great products created by your populations who really understand local need.
And I suppose the connected health cluster can also give you recommendations.
Absolutely.
It was in the form of a question here, but I...
Yeah, absolutely. Yeah, and so I'll put my email address on again. Just drop me an email. We'd be delighted to hear from you.
And another question upvoted, why Estonia and Holland?
Okay, so why Estonia and Holland? So I have been fortunate, as I mentioned before, to work across Europe in the past. I actually used to work with the European Connected Health Alliance. And I've been to Estonia, this is my third time, but even before I came, it was interesting seeing some of the results. As an outsider, Estonia are really innovative and very digital. And when I've spoken to people in Estonia, people seem ready for this. That situation has also been seen in Holland when I've been over to Holland. And so I was really keen to start with the willing. We are talking about innovation here, and it's a normal distribution curve. And so I wanted to start our work in areas that were more innovative than others and more ready for this. This part of the project with the EIT is to assess whether that hypothesis is correct, which I'm hoping it is.
Okay, and to wrap up, can you maybe give some examples of major brands that use Orca as the quality standard for their app promotion?
Absolutely. So we work with all health apps. So just, you've obviously got your big brands like Fitbit, and Fitbit is on there. We also have been asked by organisations like Johnson & Johnson to put apps through the process. But for me, where I think we really come into our own is working with startups and very small companies who are really innovative. Because at the moment, when you go to the App Store, it's massively gamed. And what you see is promotion of the wealthiest companies, not necessarily the best. And so a lot of organisations that we work with are very small. They might even be single-handed. And we're really keen to promote the true innovators through the platform.
Okay, thank you very much. Let's give a round of applause for Liz. We also have a small present